joining us here. Good afternoon. Thank you so much for joining us here today. My name is Michael Wood. I will be the host of this webinar today. Over the past 23 months, I've become the voice of small business in Ottawa. The past 23 months have been difficult, not only for small business owners, but for the workers as well. In fact, it's been difficult for our entire community. That's why I reached out to Gord Garner from the Community Addictions Peer Support Association, or better known as CAPSA, to put together resources so that we can start moving forward towards wellness from here. Today, we'll be discussing mental health and substance use health resources for us all. We have a tremendous lineup of experts who are here to share these resources with you. Those guests include the Ontario Minister of Mental Health and Addictions, Michael Tibollo, Vice President of CAPSA, himself, Gord Garner, Dr. Kim Corace, who will be making a presentation on AccessMHA, and Josée Blackburn, who will be presenting on onecallonclick.ca. I would encourage you all to ask questions in the chat. We will do our very best to answer the questions throughout the webinar. At this time, I will pass the conversation over to Minister Tobol. Minister, thank you so much for joining us today. Please introduce yourself and go ahead with your presentation.
Thank you so much, Michael. And I think I'm off. Am I? Sorry, can you hear me, Michael? Okay, great. Thank you. Thank you so much for the invitation and for the opportunity to be here today and to speak. As was mentioned, I'm Michael Tobol. I'm the minister responsible for mental health and addictions for the province. And I'm really glad to be here with all of you today. And I want to thank you all, especially all of you that continue to provide supports and services in Ottawa. I know that it's been a particularly difficult time for all of you, the frontline workers, the first responders, those providing mental health care supports, the small businesses. I mean, it's been, layered upon you, the difficulties, first with the lockdowns, and then of course, with everything that's been happening in Ottawa lately. I really want to say thank you for the perseverance, the continued effort to keep everything moving and working and functioning. And it certainly doesn't go unnoticed with me and the work that I do. I mean, we've all seen that COVID-19 has had an incredible impact on all the families in our communities throughout the province. And we certainly are in a position that as government, we must do more. It's been 2 years that families, businesses, and communities have all faced challenges due to unpredictable situations. And we've never seen anything like this. It truly is unprecedented. And what this has done, this situation has shown us the collective resiliency of our communities, the fact that we have been able to persevere and really pivot as service providers to be able to deal with complicated situations where in-service or services, face-to-face services have not been able to be provided because of COVID-19 and the use of virtual supports. And with physical isolation, financial challenges, and constant health concerns, it truly is for us a difficult situation with all kinds of impacts on the mental health of families and individuals. And this has also exacerbated the situation, not only in more situations being identified, but also more complex challenges and increased demands for services and supports. Research and data have continued to show that people across the province are experiencing increased levels of anxiety and depression. Young people are experiencing increased suicidal ideation. And I can't begin to tell you the complexities that we've seen as a result of the pandemic on an increase of eating disorders and the impacts that that's had on our children and youth. And unfortunately, while continuing to fight COVID-19 and its variants, there have been many aspects that had an impact on every aspect of our lives. And, we still, notwithstanding the pandemic, have another equally important battle that we're waging and that we have to succeed at as well. And that's the one that has to do with the surge in addictions and mental health challenges in the province. And for those that don't know my background, I have a personal connection to mental health and addictions. I didn't come to government and became the Minister of Mental Health and Addictions. I lobbied for this and became the first minister, I think, because of the background that I have. I am a certified addictions counselor. I've worked on the front line. I ran an addiction, a bed-based treatment center in Vaughan, Ontario, and certainly I'm very familiar with the needs of individuals prior to the pandemic. And of course, the waiting lists that have now increased exponentially as a result of increased need as a result of the pandemic. And the years that I spent delivering bed-based treatment in therapeutic communities has led me to understanding the need for a systems approach to mental health and addiction treatment in the province, to needing to build a continuum of care that focuses on delivering as many supports and services when and where the individuals require them. I've worked, as I said, with the front lines, and I've seen the devastation that things like opioids and the polysubstance overdoses that continue to occur in the province are having on individuals. And as the Minister responsible for mental health and addictions, I continue to hear stories about how difficult it is for someone struggling with an addiction to find a way to get services, or they get some services and then they can't seem to find the other services they need. And of course, the underlying social determinants of health, whether it's housing or education or the ability to actually get the supports an individual needs to feel that they can fulfill their lives. That hope is still something that we're grasping or grappling with, trying to find ways to build that continuum and to do more. And of course, the pandemic again has exacerbated this, and the devastating impact is being felt in the province, in every community. I dare say in every family. And, in people of all ages, we hear about the devastation that this is causing at every level of life, whether it's mental health and the inability to get supports and services, or addictions and the inability to find spaces for individuals to get help. And that's something that we're firmly committed in resolving and looking for ways to find life-saving and stabilizing interventions and treatments. That's something that I take very seriously and want to make a change. Just last week, I'm sure some of you heard, and I can't tell you how honored, because it took me a little bit of time to persuade the system that we need to invest more money in bed-based treatment. And that $90 million investment as an addiction recovery fund is something that I think will immediately expand access to addiction treatment and services by adding almost 400 new treatment spots, treatment beds in the system. Now, these treatment beds are going to translate into over 7,500 treatment spots. And we all know how desperately these spots are needed, whether it's withdrawal management, whether it's treatment spaces, supportive beds. We need to build that system, and we need to build it in each and every community where individuals live. You talk about homelessness and the movement of individuals throughout the province. How many of those people are just looking for help that they can't find in their local communities? So these are things that for me are extremely important and something that needs to be done if we truly are going to build a transformational system and stay true to the goals that we laid out in our roadmap to wellness. And this is something that, I'm really interested in continuing. Evidence-based treatment in both bed-based and community-based settings, as well as virtual addiction supports. And the people around this table that I've had the opportunity to work with, and some of the presentations that are going to be made today, I do recall now the meetings that we had in Ottawa at the Royal, and the presentations that Josée and Kim made to me. They're remarkable. And this is what I would want to encourage, is innovation, transformation. The definition of insanity, I've said this so many times, we keep on doing the same thing over and over again, somehow expecting the situation to change. And that's the definition of insanity. And somehow that's what we've been doing, thinking that somehow things are going to get better. Well, they're not getting better, they're getting worse. And you all know that. And it's about time we recognize that and actually started to be transformational and look at new and innovative ways to deal with issues relating to addictions and obviously mental health issues. And so the funding that we've put in is funding that we believe will be instrumental in developing a comprehensive suite of services, policies, and programs, and they'll be coordinated through community-based organizations, local public health units, and really work together with the municipalities and community stakeholders to build that continuum of care that will make a difference and will provide the services where and when the individual needs those services. Thankfully, we have come a long way in terms of the direction we're going and building that foundational structure that will be the basis that we can build additional improvements as we measure the outcomes of the investments we're making, which is, again, a pillar of the roadmap to wellness and something that's long overdue. You know, we're trying to manage a system, but we don't have the metrics to measure it by. So once we have our ability to analyze data, we're able to do an actual system review to be able to manage it properly and ensure that where there are gaps, where there's fragmentation, we're able to address those. Before I wrap up, I want to assure all of you that mental health and addictions is a top priority for our government. I am the first minister responsible for mental health and addictions. I'm very proud of having this role. I'm very interested and engaged in making sure that we build a system. I listen to anyone that has ideas that they want to bring forward, because this clearly is one of the most pressing healthcare issues of our time. And unfortunately, as we come out of COVID-19, it will continue to be something that we've got to watch very carefully, because the tail of this pandemic will not end when COVID-19 is finally seen as endemic. So we need to do a lot more. You know, we know the statistics. In Ontario, more than half the population has experienced or will experience a mental health or addiction challenge by the age of 40. We know that over 1 million people in Ontario experience a mental health or addiction challenge each year, which has only increased during the pandemic. We know that over 500,000 people a week don't go to work because of an underlying mental health or addiction issue. We know how many people have died as a result of opioid overdoses. And the ones that have died, you know, they're not just homeless people. 30% of them, almost 4,000 people, 30% of that 4,000 people are people that work in the construction industry, building our homes, our roads. You know, these aren't people, and they're earning good salaries. These aren't people that you know, are using opioids because of any reason other than to try to manage pain. And that's not the direction we need to go. So it affects everyone. And it's important that we find an approach and treat mental health and addictions, and do that in a meaningful way with the stakeholders, with the service providers. So I think it's extremely important that we do that. I think I'm getting the bell here, and I apologize if I'm running a little bit over time, but our roadmap to wellness is funded by a $3.8 billion investment over 10 years. And I can tell you that we are now at $525 million in new spending annually going forward, in addition to the money that's being invested to deal specifically with the COVID-19 pandemic, the $194 million, this additional $90 million, and we'll continue supporting the great work that the organizations like the ones that I'm speaking with today will continue to get the funding and the supports they need, because you are truly making a difference in ways that, you know, many of you may not even imagine. I hear about it, and I'm sure you do too, but I hear about it every day that, you know, my life was saved or my son's life has been changed as a result of. So that's the encouragement I want to give you. We are making a difference, perhaps not as fast as any of us would like to see, but we are making a difference, and we'll continue working together to ensure that we deliver the best services possible as close to the home of individuals, and do that in a way that is going to keep our individuals healthy and our economy and our mental health recovering in as fast a way as possible. So thank you so much again, Michael. I'm going to turn it back to you. Truly a pleasure to be here, and I can hang around if there's some questions that anyone may have of me. Thank you.
Wonderful. Thank you so much, Minister. I truly appreciate you being here with us today. Up next, I have Gord Garner, the Vice President of the Community Addictions Peer Support Association, or CAPSA. I know that many of you are here and very interested in a presentation on substance use health. So please go ahead, Gord, and introduce yourself and begin your presentation.
Thanks, Michael. So just very quick, thank you, Minister Tobol. The passion was not lost on me, and the intention was not lost on me, and much appreciated. And a shout out to Mike, who called me up not that long ago and said we need to do something, and I couldn't agree with you more, Mike, and it's great to be here and great to be with my good friends Kim and Josée. So stigma ends with me. We know that stigma blocks most people from ever asking for help, and so we want to do something about that. And we heard today the importance of recognizing that mental health and substance use health is on an equal footing with physical health, and how do we get the funding to match that? If I can talk to you about my physical health and you don't assume I'm at the hospital and having a heart attack, if I can talk about my mental health and you don't think that I'm in a psychotic episode, why can't I talk to you about my substance use health in a normal tone of voice? What's so wrong with that? 76% of Canadians are going to use a substance next year. And we need to stop thinking about all substance use is bad. That's what we do as a society. And so what it is what we're interested in is people's health. And so there's no use, there's beneficial use, there's lower risk, there's problems occurring, there's actual substance use disorder. That's at the far end of the spectrum. But if we begin to talk about the rest of this, it'll be much easier to talk about the other end. If I know that you checked in with your physician this year on your mental health, physical health, and substance use health, I'm going to be much easier for me to check in with say, I think I'm using too much, because it's a conversation we're having. Just what that's look like. Canadians 15 years and older in the past 12 months, 78% have used alcohol, 24% identify as heavy drinkers, 15% is cannabis, 15% of cigarettes still. Illegal drugs, 3%. And so we understand that Canadians are using substances. We don't have to struggle with if that's true or not. It's what we do, it's how we have. And most of us are using them to our benefits, not to our harms, but most of us are not making informed decisions around our substance use, because I can tell you how much THC is in the cannabis that I purchased, but I can't tell you what a dose is. I can tell you what a drink of alcohol is, but I can't tell you what a drink does to me, and what 2 drinks does to me versus 1, and what 4 does to me versus 2. And so learning about substance use in a way that's healthy, so I can tell when I'm being unhealthy, is really critical upstream activity that can take place. What's happening during the pandemic, as the minister pointed out, people are turning to substances to self-soothe and get their way through this. 33% people who use cannabis have increased that use in the pre-pandemic period. 24% of people who drink more. 1 in 4. Did everybody get an addiction? Everybody get some? No, but everybody is using more substances without any information about what that impact is on their health. And some of those people will find that they've crossed the line where they are actually moving into problematic use, where they're using into a substance use disorder. And so how are we going to have that conversation with so many people? Again, mental health is right there. And again, we're seeing this closer relationship with my mental health and how I feel with how much I use. And that connection grows and grows. So be an ally. We're asking everybody on the call today and everybody in Ontario and Canada that if you can speak about these things in a manner that's non-stigmatizing, you can have this discussion. You're opening the doorway to your friends, your families, your neighbors, to enter the conversation in a way that will be beneficial to them. And so what are the words I use? How do I do that? This will be available afterwards in the chat box. Here's a QR code to learn about person first language and what stigma looks like. And I want to get to the new resources, the new access that we got, and give every bit of time. So thanks everybody for being here. Thanks, Mike, for the phone call. And again, thanks, Minister, for your important message to us all.
Gord, we've known each other a long time. You're amazing. I appreciate you putting this together with me, and I appreciate all the information. Up next, our next presenter is going to be Dr. Kim Corace, who will be sharing information regarding AccessMHA. Kim Corace, if you'd like to go ahead and please introduce yourself, that would be amazing. Thanks so much for joining us today.
Excellent. Can everyone hear me all right?
Yep.
Excellent. Thanks, Greg. So it's a pleasure to be here with everyone today. I'm Kim Corace, as Mike introduced me, and I'm delighted to be here with all of you, as well as this fabulous panel to bring forward some of the exciting initiatives and work that we're collectively doing. So I am the VP Innovation Transformation at the Royal. I'm also a clinician scientist who works in the field of substance use and mental health, and a socioprofessor in psychiatry at the University of Ottawa. I'm here today representing numerous partners and collaborators, including Josée and Gord, who are very closely part of this work as well in terms of our AccessMHA work. And I took a look at the participants list of what I could tell from names that were in the list. And I'm delighted that many of our partners for AccessMHA are also in the room. So thank you all for being part of this. So I have about 12 minutes today to talk about what this new service is. And it's very well aligned and integrated with what Josée is going to be talking about, which is the one call, one click service for our young people who we serve, all with the goal across both of our services, working together to increase access to evidence-based care for our clients, their families, and their loved ones, and meeting people where they're at the time when they need it most, collectively as our community. So Minister touched a bit on this as well in the intro, and I think this is well known in terms of what the roadmap to wellness is as well, and what our system knows. We've heard from clients, we've heard from families, we've heard from providers, and those of us who work in the system that the system is really complex, that there's a lack of coordination, there's extensive wait times, and there's many gaps in the services that people need. And unfortunately, the hospital emergency departments become the default place for people to access services. The staffing levels and geographic distribution of where services are do not only meet the client needs, and clients and families report a limited standardization in their experience of when they reach out to get help, how they get help, how confusing and complex it is to get help. And there are real challenges in really knowing what does our system need, what is our system-wide data to show us where the gaps are, what the needs are, and where people go, and how do we monitor that? And I know when we do this work, and Gord's very, very much part through his work in CAPSA as a leader in this work. So thank you, Gord, for all that you've done with this. And I always remark when I show this slide that what you've said is, yes, getting people to the service is of course of utmost importance, but actually understanding the data and what are our population health needs and trends, what are those gaps, is as important in understanding this work. So this is collaborative work that's happened over 3.5 to 4 years, actually, on a journey that we've embarked on with many stakeholders. Most importantly, our persons with lived experience experts, as well as health service providers, social service and community agencies, CHCs, primary care providers, hospitals, really to understand how can we work together to make it simpler, easy, and to get people what they need when they need it. In terms of mental health, substance use, health, and addiction services. So over the past 3 years, we've done this work, and in March of 2021, we launched the digitally enabled regional coordinated access, which is branded as AccessMHA. What it is it provides a one-stop shop to get into the mental health and addiction system, regardless of where people live, using standardized intake process and tools to help people navigate to the right service. So really focusing on matching people to the level of care that they need, with folks not having to navigate the challenging system, but us doing the navigation and the system matching for clients based on their needs and their goals and what they're looking for. The important part of this is everybody working together as a system to make this happen. This is not one agency. This isn't one organization. This is a collective of folks who've come together to realize this in our region, most importantly with leadership from our clients, families, and peers who have designed this system and a system for them and by them. So the intention is to have many modes of access. However, given COVID and given what we heard from our clients and families and peer leaders, we started with digital enabled access, which includes both e-referral integrated to the health records and the charts of primary care providers, as well as online access for clients, families, and loved ones to refer themselves. I won't go into all the details other than some high level that AccessMHA staff are actually employed amongst partner sites with the concept of a geographically dispersed hub, such that it allows access to care across the region for services provided in the community by the community. Referrals and access to care is based on availability and preference, not limited to geographic region, with a real focus on standardized screening, assessment, and navigation for similar client experience. Important in all of this is integrated peer support as well as digital resources. So I am going to try to share, Karen walk me through this. A little video that was developed by our peer and person with lived expertise leads. In 45 seconds, it will tell you what seemingly is taking me 12 minutes. Can you give me a thumbs up?
Do you or a loved one need help with mental health, substance use, or addiction? AccessMHA is a single portal through which residents of Eastern Ontario who are 16 years of age and older can access mental health, substance use, and addiction support when they need it. The healthcare system can be complex, confusing, and overwhelming. AccessMHA provides a clearer path and simplifies access to mental health and addictions care for everyone. Just fill out a simple form at accessmha.ca to book a confidential phone call with a mental health and addictions professional. You'll be connected to services that will meet your needs. All services are funded by the Province of Ontario, and there's no cost to you. If you are concerned about your mental health, substance use, or addiction, or that of a loved one, go to accessmha.ca.
So that is, so thanks to those who helped put that together to really get the message out there. For those who are looking for services, because I think that's why we're here, is to show how folks, new resources are available. You can go to the accessmha.ca website, and right from that website, you can book an appointment to speak with a mental health and substance use health professional who can speak to you, meet your needs, and then directly connect you to one of our numerous partners, who I will give a shout out to them in a second on the next slide, or as well as peer support to help navigate through the process. And the idea is one starting point, one assessment process, one referral process, so that when folks are experiencing challenges, they get to the service when they need it. Primary care can refer directly from their EHR as well. And as you can see, we have numerous partners who are part of this work. Not everybody's logo is on this slide just because we're still onboarding new agencies who are part of this work, but you can see it crosses all different types of services that are in our region, as well as peer support services, substance use health services, mental health services, concurrent disorder services, peer services, and all the hospitals are connected through here, as well as most of all the community services. So I want to give a huge shout out to all folks who have come together during a time of COVID, when things are stretched and strained, to put their time and energy into making this happen and making this happen for our community. So thanks to all of you who have helped do this work. It's a very highly used service. In the first 10 months, we served over 5,000, so nearly 5,500 clients, which actually looks at over 14,000 direct contacts with clients. And I think what's interesting is some of the data that we have out of this, so that in fact, one of the key problem areas people are looking for help with is actually substance use and addiction, then depression, anxiety, trauma, and abuse. And the majority of people report multiple problem areas. And I think clinically that's really important, speaks to the need for our services to address that. 21% of people who reached out for services are from the Black, Indigenous, and persons of color community. And you can see the gender distribution here on the slide as well. You can see here that we have quite good regional reach, people accessing services from all over the Champlain region in the distribution that we'd expect based on population health need. We have built in measurement-based care and into Access MHA so that we can better understand what are the levels of severities and what is the types of problems people are coming and looking for help with. And then of course, following people over time. And you can see here that people are reaching out with moderate anxiety, moderate to severe depression, significant impairment in work and social functioning, moderate to high severity of problems related to substance use. And also the importance of why we have 24/7 access through the digital platform, because a quarter of folks are reaching out in the evenings and into the night. Also importantly, where do people go for service? Where are people being matched? You can see here the vast majority of people are being matched to community services. And then as this service gets more intense, the fewer number of people match. And that's exactly what we want to see in terms of core outcomes and a core service framework and in terms of step care. What we know is although Access MHA helps folks get into the initial part of the system, it also helps them through the continuum of care and through their journey, such that as clients and people looking for services are matched to a service, Access MHA can help them get to that next level of service as they need it. So hopefully we can see that together, both Access MHA and of course in partnership with One Call, One Click, the goal is really to increase access to the system, improve that access, improve that journey, better integrate with primary care. We can no longer separate mental health and substance use health from health. They are all health, and we need to address that concurrently and in an integrated way, hopefully leading to a better connected and coordinated system and getting the data that we need to better understand what does our population need, what are they looking for, where are those services that they can be matched to, and what's missing, and where do we need to go from here collectively. I want to thank all the partners. I think I'm right on task here, Gord, with my minutes. So, we'll turn it back over to you, Mike. Thank you so much for everyone. And as I said, I'm here representing many who are part of this collaborative as we work to scale and spread this together. And thanks to you, Gord, of course, for your leadership to make this happen.
Wonderful. Thank you so much, Dr. Corace. I truly appreciate it. There's a lot of valuable information in the presentation. And I know the panelists and the people participating have found it to be excellent. Lots of comments in the chat. Up next, we have Josée Blackburn. He will be making a presentation on onecallonclick.ca. Josée, if you'd like to go ahead and introduce yourself, please, and talk about onecallonclick.ca, that'd be amazing. Thank you.
Thank you. Can you just give me thumbs up that you can see my slides? Perfect. Thank you so much for inviting me to be part of this panel. As Mike mentioned, I'm Josée Blackburn, and I'm the Director of Operations and Project for the Kids Come First Health Team, specifically the Mental Health, Substance Use, Health, Addiction Table. So I sort of oversee a number of projects and programs under our health team. And one of our first one out of the gate was One Call, One Click. And so today I'm here to talk to you a little bit about that. I have similar messaging to give you that you've already heard from Kim. So I might go a little quicker in some of the slides and give you ample opportunities to ask questions. I see there's already some questions in the chat. So really, this was an initiative of the Kids Come First Health Team. Really looking at a transformational regional coordinated access and navigation service. You will see that as part of this presentation, it's starting to grow other tentacles, and I'll explain a little bit why that is. But on the onset, there was really a commitment to have tangible and meaningful improvement around quality access. And the health team really brought together this operational working group to look at creating this regional coordinated access. And at the core of it, it really was a co-design with family and family leads and youth leads that really directed and guided the conversation and the design of One Call, One Click, along with some of the experts and service provider to really create what we know today to be One Call, One Click. you know, Kim spoke to the challenges. Minister Tibollo also spoke to those. So I will spend very little time. I think we all understand that there was very difficult navigation of our system. We heard loud and clear from families and from young people that it was difficult to access. It was not coordinated. There was a number of gaps and it was limited. When in fact we knew that there were services that could help them. People had expressed challenges to reaching them. One of the things we also were mindful of in the children and youth sector, there was a bit of a separate sort of silo between mental health and substance use health, and we really wanted to work into the integration of both of those, and as Kim mentioned, just overall health. So some of our goals was really to better connect the system, to find it easier to navigate, to increase our community capacity. But one of the vision that I have from the working group listening to parents and caregivers is we wanted to take the backpack off their back and carry that for them. And so that they didn't have to be coordinators for their loved ones, that we could take over coordinating and navigating and really helping them reach the right place at the right time. We wanted to just improve some of the access. Our physicians had mentioned that it was difficult for them as well, and remove some of those barriers. Part of what we're also noticing, and it was one of our big goals, is we could together really start to understand what are the needs, have the data to make informed decisions about what treatment needs might be needed in time. So what is One Call, One Click? It's one number to call, one link to click for clients and provider. It's access to virtual services, service matching and navigation, hands-on care coordination when needed, and family peer support. I did see some comments in the chat about making sure that we have adults that are well to support their young and their loved one, their children and their youth. So that definitely was core of the design of One Call, One Click. What I love about this slide is very busy, and I don't expect people to be able to read, but it's the extent to which so many individuals and organizations and agencies are behind these types of program. And you can see between One Call, One Click and AccessMHA that at the hub, we're able to work in the background to make it seamless, no matter where the young person come for help, and that we work with so many partners, family and youth as well, to create what we have available. So by reaching One Call, One Click, in fact, you're reaching all these agencies and these partners. So what are some of the core services we provide? If you call or if you speak with one of our clinical team members, you can have information about the system and resources. You can have a full appointment where we'll provide navigation and matching options. What you see, the third one is a bit grayed out. It's an area that we're currently developing, is a care coordination for complex needs. When we flag that would be something useful to the family, we would like to have a care coordinator really support them through the process. We have family peer support. And just this fall, we were able to bring under our program the school-based mental health and addiction nurses program to support also those young people in the school. We are available for little ones up to the age of 21. You will see that there's an overlap between ourselves and AccessMHA, and that was purposeful. There's a lot of the transitional youth that falls between a crack, and there are services within the sector. So we really wanted to make sure we paid attention to that group. We cover Eastern Ontario at this time. And really we can help anyone navigate. A little bit like Kim, there's multiple ways to access. You can call us and directly speak with an intake worker by using the regional toll-free number. What we did on the onset of designing One Call, One Click is we integrated the regional crisis line with our phone number. So when you call our number, you actually are prompted. If you're in crisis, you can speak to a crisis worker. And if you want to speak to a One Call, One Click intake worker, you can do that. You can complete an online form and have someone call you to help you navigate making an appointment, or you can actually go on our website. We went live yesterday with self-scheduling. You can book your own appointment by going online on our website. If you're a professional and you want to refer, or a parent, you can, as well, a parent can also refer their child. We can, if you're a professional, you can also use, similarly to what Kim described, the e-referral network through Ocean. Some are using Epicare Link. We have third-party online form, and we even have the old-fashioned fax. I'm hopeful we can get rid of fax some days, but we heard that many people are still using them, so we didn't want that to be a barrier. So again, how it works is once you've connected either live through the telephone, or you filled out, or you booked, you get to meet with one of our clinical team members, and they will go through a standardized sort of process of looking at tools to look at what might be some of the needs, really matching to the step-care approach. We look to flag for complex needs, and we really spend some time on speaking to the child, youth, and their family about what are their goals, what would they like to work on, and then we review options with them. And once that's done, we really, the workers take care of matching, completing the referral, connecting them to the agency so that they don't have to do anything else on their own. So we've been live we went with our public announcement going live mid-June, so for about 8 months. And you can see that we've seen about over 2,500 children and youth, unique clients. We've provided about 400 support to parents and caregivers. So this is always offered to a family if they want to have a family peer support worker. You'll see this is busy again, but one of the main problems that we're noticing is definitely, as Minister Tibollo mentioned, anxiety and depression are definitely some of the primary problems that we're seeing right now. Approximately 45% of our clients are young people between the ages of 12 and 15, and they typically have moderate needs. And the majority of the referrals currently that we receive are from their providers. So most of it are physicians that are referring their client to us. And I would invite you to visit our website. And if you take a little screenshot with the QR code, it will get you right there and right away. So I think what that means for us is that it's starting to provide us a lot of information about what young people need at this time and in real time. And I know that we're able to show very clearly with the needs that are coming in around anxiety and depression, but we're also noticing some new trends for young people. And for example, one that I'd like to make note of, the substance use health / addictions. We're starting some new emerging trends that are coming our way. And so the technology, the gambling are something that we're really concerned about. And new emerging, and I think really the pandemic as played a huge role in our the infants and the early childhood mental health has been a focus and a priority for us as well. Since we're hearing from our schools that children are arriving, they are not socialized, they may not. So there's been a lot of impact on the young ones as well. So I think, we feel that this, between AccessMHA and One Call, One Click, we have aligned some of our common data elements that we will be able to show regionally. And I think this will be trends that would be current, meaning even for the province, for the country, of what's happening on the ground and what are some of the real-time needs that we're noticing for people, so that we can place the right investments into some of the needs that we're seeing. Thank you.
Thank you so much, Josée. It was excellent. The information was excellent. We do have a lot of people with some questions as well too. So that was great. We will get to the questions as soon as the presentations do come to a close. Up next, we do go back to Gord Garner. Gord, you are going to be introducing the Metameter interactive activity for this afternoon. If you'd like to go ahead with that, that would be great.
I am. So we're going to share this in the chat box with everybody. And so this is where we're asking you for your help and your ideas about how we can help each other to move forward from where we're at. I think we can get lost in the conversation about how we got here. And I want to have a little conversation about where we're going to go to and what qualities are we going to focus on to get there with each other. And so what comes to my mind is we've learned that perhaps we're going to be more compassionate. So you go to the cloud, you put in your words, and we're going to build a cloud of the attendees today's feelings about how we want to be with each other. And I can go and bait you by putting in a few words to begin with, but I'm confident in the attendees.
So while we're waiting for the words to come in, there is a link in the chat that the participants can click, and it will take you to the screen to enter the words.
Good. I'm just waiting to see if things working or not here. Give me a second. Results are hidden. There we go. Gosh. Hi, everybody. That was close. I thought no one was doing anything. So, hi. So if I look at these, if I look at this and imagine everybody here today and their families and friends and colleagues, right, going out this afternoon and keeping this in mind with everybody we come in contact with, eh? Can we just be a little more understanding with each other? Can we be part of the solution? Even if we're struggling ourselves, can we just for a moment wonder how the other person is? And can we act in this manner as best we can today? If I'm not sure how I'm doing, can I ask someone else how I'm doing? All right, and have them inform me about that. We're going to make a t-shirt out of this with our logos on the back and one call, one click and AccessMHA and CAPSA, and then we'd like to send them to you. So if you want to email us at info@capsa.ca, all you got to say is, hey, I want one of the shirts. My size is, and here's my address, and we'll mail it out to you. And I promise you, we won't send you donation letters or anything else. We just want you to send the t-shirt and you can carry it around, wear it in the community. And when someone says, what's that about? You say, I'm making a difference. And I want you to know how I'm feeling today and how are you feeling today. Deal? Okay. And I want to do a verbal conversation with you about one other resource before we get to the Q&A, and that's Wellness Together Canada. It's another website that we can access. There's peer support there. There's tools, there's training, there's information that can be a benefit to you. So 24 hours a day. I think Karen's going to put that in the chat box. There it is. So you can click on that link. And for time's sake, I did condense my remarks earlier, so I'll tell you a little bit about CAPSA. We're a nationally facing community organization that does training on stigma and person-first language and hosts all people, all pathway peer support groups online off our website, but also online on the Wellness Together portal, coming to Ontario soon, I'm sure. And the concept there is the idea that you do not have to self-diagnose. You can just come and ask the question, how am I doing with my relationship with substances? That's it. And we're sure if you ask those questions, you'll find your way to your answers. But if you have to wait to self-diagnose to qualify to get to a group or to get to help, so many people don't want to have what some of us have. that the reaching out is really delayed. Only 1 in 10 people ever get to the door. So we're trying to access the other 9. We're trying to get data on that so that we can give people like Minister Tibollo the information he needs to make his case within a political sphere, within a budget constraint that says these are the numbers. This is how much work there is to be done. And all people, all pathways means that we would celebrate anybody's moving along the line of health to wherever that is. And I say that as someone who was a counselor. I say that as someone who lived in active addiction for 38 years. I say that as someone who celebrates anybody's step towards a better life. No matter how small it looks like to me, I know how big it is to them. And so with that in mind, it's time for me to be quiet again and to get to some of the questions. Mike?
Thank you so much, Gordon. Thank you so much to all of our presenters today. The information has been amazing. There's a lot of people that do have some follow-up questions to the presentations. And so, what we'll do is if one of the presenters would like to answer the question, if you just like to raise your digital hand just to make sure that the information gets out as quickly as possible. We have about 10 minutes left. So one of the questions in the Q&A here, somebody was asking, what is the current wait time for one call, one click to get an appointment from first caller online form? So Josée, is there a timeline that people can expect?
Yes, thank you for the question. Because we do have our telephone line Monday to Friday from 9 to 5 p.m. open, then it's immediate. If they call during this time, they can get to speak to an intake worker immediately. Some people may prefer to submit an online form or booked an appointment online and then wait for that appointment to be booked. Then that could vary between 1 to 2 weeks. We're really our vision and our goal would be that it would be 24 to 48 hours turnaround. So we're working towards that. But right now we did see a really steep increase in referrals from the moment we went live to today. So we're going to need to make some adjustment. But if someone in the moment wants to speak to someone right away, if they call within the hours of the telephone line, they can speak to an intake worker immediately.
Wonderful. Thank you very much, Josée, for the question. I'm getting questions in the chat and also from text messages as well too. Gord, this question is for you. In terms of treatment centers, are there treatment centers that you feel are the most advantageous for those that are potentially considering entering one, or should there be ones that people are looking at in particular?
So the help that is best always is the one that I'm at. And so that idea that reaching out, often we try to figure out where should I go and where am I going to go that's going to help me? And we don't really know even where we're starting from, right? So we can just get there and say, hey, I need help. And whoever's at the door is going to have some form of help for me if it's just a caring moment. And yes, I believe that there should be skill on the other side of the door. And yes, I believe there should be all kinds of processes in place. But more importantly than anything else, I believe I should get to the door, I should ask for help, and I should be greeted with enthusiasm and optimism. I should never be told I'm at the wrong door and they can't help someone like me, ever.
That's great, Gord. Very well said and truly appreciated. The next question is coming from who I believe to be youth. The question is there any way to open lines of communication around what your services are currently seeing? I think having an open discussion about what you folks are seeing will help people, again, not feel perhaps quite as alone. It says, for example, in the post-secondary space, it would be great to know what you folks are seeing for our age group and target our education prevention efforts. Dr. Corace, would you like to answer that question?
Sure. And then Josée, if you want to fill in too, obviously we have overlap of that age group. So we see lots of young people in the post-secondary group. I think what's always important when we look at this data isn't the data that's owned by AccessMHA. And I'm sure Josée would say the same thing about, I don't like to speak for you, but I know you pretty well, for one call, one click. This is the data that's owned by the people who seek services, and this is data that's owned by our communities. So making this forward facing, and if people in the post-secondary space want to reach out and say, you've served 5,500 people and 20 some odd % are in our age group, how can we learn from what AccessMHA has learned, so we understand where are people going, what are people needing? Reach out. As I said, we're collecting this for the benefit of others, and I'm sure Gord would be okay if you reached out to him about AccessMHA. You can reach out to me as well, but certainly the goal is, how do we collectively use this to create a system that we need for the people we're trying to serve?
Excellent. Josée, would you like to add?
Yes, I mean, I love this question. We submitted a research grant, and CIHR grant, and we're successful in obtaining that grant to do exactly that knowledge brief that we will be able to provide our community, to let them know what we're seeing. As I agree with Kim, this is everyone's data together collectively, and how we can best sort of align our resources and our services. So we are very excited to be able to embark on this work with many, many collaborators, and the Knowledge Institute, the Research Institute at CHEO, and many, many others. And we will have knowledge transfer and knowledge brief that will be available publicly for people to see exactly that information.
Wonderful. Thank you very much, Josée. Minister Tibollo, there are people asking what the best way would be to get hold of your ministry with further questions, such as additional treatment beds and when will things like that become fully operational. Is there a best way for people to reach out to you through the ministry?
Sure. The best way, Michael, would be just to send an email. My staff's online, but I'm just going to, my personal, my email, michael.tobolo@ontario.ca, and that comes to me. It goes to my chief of staff, and I'd be more than happy to answer some questions. I noticed there were a few questions directed to me, so I'd be more than happy to have conversations one-on-one or respond in writing, whatever is best for individuals. So I have no problem doing that, and look forward to it.
Thank you very much, Minister. I truly appreciate it. I do see a question here in the Q&A saying that there is a gap in options for women in treatment and recovery. And perhaps Gord and Dr. Corace could, maybe give some more information on, the fact that single moms face a larger barrier regarding assistance and stigma, and how can people, get the support that they do need.
There's a reason that we work on stigma as our first priority at all times. The intersectionality of that, the false beliefs around who should have this and who shouldn't have this, and who's a really, really bad person if you have this. If I ask for help, you're going to take my baby away from me. And we know the evidence says that the children that are removed from parental care suffer. And yet for this condition, that's what we do to people. The incredible courage of women to reach out for help is something. And unfortunately, all too often, that courage comes from a great suffering and desperation. And so as a son, as a colleague, and as a friend, I think we have a duty nationally and provincially to ensure our mothers, our sisters, our neighbors are not faced with that barrier to simply saying, I need some help. And then when they say that, once again, that there's a doorway there, and someone the other way of the doorway is there to say there is help, and we're here for you. Congratulations on asking for it, not shaming someone because they need it.
Gord, if I can just jump in on that point, one of the things that we have done is look at programs for mothers and children, so that we do have supports. And I can name a few of the organizations around the province that we started to support. There has been a deficiency in providing supports and services to women. Traditionally, it seems that it's been men that have had the addiction issues, and a lot of the systems have been built around supports for them. But we've recognized the fact that this is not a disease or an illness that discriminates men or women, and that there are a lot more women that need support. And of course, that stigma and the fear of losing their children is something that we need to overcome by providing services that address that issue for women and ensure that they get to keep their kids and provide the nurturing that the kids need to be able to go forward. So we have invested as part of the recovery fund, as you will see, supports for women and children. So that's something that we have tried to address.
Wonderful.
Yeah.
Thank you very much, Minister.
And just to add to that, we've done some research in the area looking at gender differences and barriers to access to care, as well as perceived stigma. And we have found higher rates of perceived stigma for women compared to men when accessing services, probably for the reasons, many outlined in the chat, as well as some specific barriers that are actually quite gendered as well. So really important not to have a one size fits all. And as you know, this group is saying, and making sure that those services are tailored to people's needs, and understands that it behooves our system to figure out how to address those barriers, as opposed to expecting folks in need to navigate them.
If I can go one step further on all that, it's like my comments on people experiencing homelessness. We need not ask what's wrong with the people who experience homelessness. We need to ask what's wrong with the 33 million of us that allow them to be homeless. And so we don't need to worry so much about why people are struggling with substance use. We need to worry why we have not as a society. And I don't mean in the last 4 years, Minister, I mean in the last 100 years, why we as a society have not been helpful to our friends, our family members, ourselves.
I agree, Gord. Thank you very much for that. At this time, it is 1 o'clock. I know that people do have other engagements to get to. I would just like, perhaps, Gord, if you'd like to make a concluding statement to the webinar today. I appreciate everybody joining us, the panelists, the participants, and perhaps, Gord, if people wanted to get more assistance or reach out, how can they go about doing that?
Thanks. And so I guess what I would say to everybody here today is you're here, right? You're here with us. We're nodding heads together. I see lots in the chat box about what else we can do. And so I would ask us all that when we leave here today, that we don't leave the conversation here. We take it to simpler places. We don't have to do grand acts. We can have a coffee with someone. We can look someone in the eye when we cross paths on the street. We can bring this into our lives. And that's where we have influence, mostly with ourselves. For help, one call, one click, sorry, Josée, and AccessMHA are the beginning of what is a social revolution here in Ontario to say there's easy way to get to the door. And as we gather data, we'll find out how little behind the door there is, and we'll start building more resources and more services. And so I'm just thrilled that we're doing that. And I'm thrilled that so many people came out today. And again, Mike, even 5 years ago, if you said to me, let's do this thing, there wouldn't have been one AccessMHA, there wouldn't have been one call, one click. There wouldn't have been 60 people join us on Wednesday at noon hour to have this conversation. And so how much progress has been made, it's wonderful. Let's keep going.
Wonderful. Thank you so much to you, Gord. Thank you, Josée. Thank you, Dr. Corace. I see that the minister had to leave, but thank you all. Thank you all the participants. And I wish you all nothing but health and happiness as we move forward today from here. Thank you, everyone.